51. What should a nurse do first when a patient's foresight looks swollen? A. Remove the fore immediately. B. Assess the site for redness and pain. C. Increase the fore flow rate. D. Notify the physician. Answer. Assess the site for redness and pain. Rationale. Assessing the site first identifies infiltration or infection, guiding next steps. Option A may be premature. Option C worsens issues. Option D follows assessment. 52. Which action best prevents the spread of airborne pathogens? A. Wear gloves only. B. Use an N95 mask and negative pressure room. C. Wash hands after contact. D. Keep the door open. Answer. Use an N95 mask and negative pressure room. Rationale. Airborne pathogens require specific precautions like N95 masks and isolation to contain spread. Option B is correct. Options A and C are insufficient. Option D increases risk. 53. How should a nurse address a patient who doesn't speak English? A. Speak louder in English. B. Use a certified interpreter. C. Rely on family to translate. D. Use hand gestures only. Answer. Use a certified interpreter. Rationale. A certified interpreter ensures accurate, professional communication, respecting patient needs. Option A is ineffective. Option C risks errors. Option D limits understanding. 54. What is the safest way to dispose of a used needle after an injection? A. Recap it and throw it away. B. Place it in a sharps container immediately. C. Leave it on the tray. D. Bend it before disposal. Answer. Place it in a sharps container immediately. Rationale. Immediate disposal in a sharps container prevents needle stick injuries per safety standards. Option B is correct. Options A, C, and D increase injury risk and violate protocol. 55. Which findings should a nurse prioritize in a patient after surgery? A. Temp of 99 degrees Fahrenheit. B. Shallow breathing at 8 per minute. C. BP of 130/85 mmHg. D. Pulse of 88 beats per minute. Answer. Shallow breathing at 8 per minute. Rationale. Shallow, slow breathing, normal 12 to 20, signals respiratory depression, a critical post-op issue. Option B needs urgent attention. Options A, C, and D are within normal limits. 56. What should a nurse do to protect patient dignity during a procedure? A. Expose only the needed area. B. Leave the patient fully uncovered. C. Discuss the case in public. D. Rush through the procedure. Answer. Expose only the needed area. Rationale. Minimal exposure respects dignity and privacy, a core nursing principle. Option A is correct. Options B, C, and D compromise dignity and professionalism. 57. How should a nurse assist a patient with ambulation after a stroke? A. Walk them without support. B. Use a walker and stay on the weak side. C. Carry them to the destination. D. Tell them to stay in bed. Answer. Use a walker and stay on the weak side. Rationale. A walker provides stability, and supporting the weak side ensures safety post-stroke. Option B is best. Option A risks falls. Option C reduces independence. Option D limits recovery. 58. What should a nurse teach a patient about managing diabetes at home? A. Check blood sugar regularly. B. Eat sweets to maintain energy. C. Skip insulin if feeling well. D. Avoid all exercise. Answer. Check blood sugar regularly. Rationale. Regular monitoring helps manage diabetes effectively, preventing complications. Option A is key. Options B, C, and D worsen control and are unsafe. 59. Which step confirms a medication order before administration? A. Match the order to the March B. Give it based on verbal instructions. C. Assume it's correct from pharmacy. D. Skip checking if busy. Answer. Match the order to the March rationale. Matching the order to the medication administration record ensures accuracy and safety. Option A follows protocol. Options B, C, and D risk errors and harm. 60. What should a nurse assess in a patient with a new cast on their leg? A. Color, sensation, and movement. B. Patient's mood only. C. Room cleanliness. D. Time since last meal. Answer: color, sensation, and movement. Rationale: assessing neurovascular status, color, sensation, movement, checks for circulation issues like compartment syndrome. Option A is critical. Options B, C, and D are unrelated or secondary. 61. What is the best way to clean a spill of body fluids on the floor? A. Wipe it with a dry cloth. B. Use a bleach solution and gloves. C. Leave it for housekeeping. D. Mop with water only. Answer: use a bleach solution and gloves. Rationale: bleach disinfects biohazards and gloves protect the nurse per infection control standards. Option B is correct. Options A and D don't disinfect. Option C delays action. 62. Which action upholds a patient's right to informed consent? A. Explain the procedure's risks and benefits. B. Perform it without discussion. C. Let family decide for them. D. Skip consent if urgent. Answer: explain the procedure's risks and benefits. Rationale: informed consent requires understanding risks and benefits, a legal right. Option A ensures this. Options B, C, and D violate autonomy or consent principles, even in emergencies. 63. How should a nurse position a patient with pneumonia to aid breathing? A. Flat on their back. B. Semi-Fowlers at 30 to 45 degrees. C. Prone on their stomach. D. Fully upright at 90 degrees. Answer: semi-Fowlers at 30 to 45 degrees. Rationale: semi-Fowlers eases lung expansion and breathing in pneumonia. Option B is best. Option A worsens it. Option C is uncomfortable. Option D may strain the patient. 64. What should a nurse do first if a patient chokes during a meal? A. Call for help immediately. B. Perform the Heimlich maneuver. C. Give water to wash it down. D. Wait to see if it clears. Answer: perform the Heimlich maneuver. Rationale: the Heimlich clears the airway, the priority in choking. Option B is first if trained. Option A follows. Option C risks aspiration. Option D delays critical action. 65. Which precaution is needed for a patient with C. difficile infection? A. Airborne precautions. B. Contact precautions with soap washing. C. Droplet precautions. D. Standard precautions only. Answer: contact precautions with soap washing. Rationale: C. Diff spreads via contact. Soap is needed as alcohol doesn't kill spores. Option B is correct. Options A and C are wrong modes. Option D is insufficient. 66. What should a nurse check before inserting a urinary catheter? A. Patient's last void time only. B. Sterility of equipment and patient ID. C. Room lighting conditions. D. Family presence in the room. Answer: sterility of equipment and patient ID. Rationale: sterility prevents infection, and ID ensures the right patient, both critical. Option B is key. Options A, C, and D are secondary or unrelated to the procedure's safety. 67. How should a nurse respond to a patient's spiritual needs? A. Ignore them as unimportant. B. Offer to contact a chaplain if desired. C. Tell them to pray alone. D. Discuss personal beliefs. Answer: offer to contact a chaplain if desired. Rationale: supporting spiritual needs respects patient values. A chaplain provides expert care. Option B is best. Options A and C dismiss needs. Option D risks imposing beliefs. 68. What should a nurse teach a patient to prevent deep vein thrombosis? A. Sit still for long periods. B. Perform leg exercises regularly. C. Wear tight socks only. D. Avoid drinking water. Answer: perform leg exercises regularly. Rationale: Leg exercises promote circulation, reducing DVT risk. Option B is correct. Option A increases risk. Option C is incomplete. Option D dehydrates, worsening risk. 69. Which action ensures safety when administering oxygen via nasal cannula? A. Set flow rate without checking orders. B. Verify the flow rate and secure it. C. Leave it loose around the neck. D. Use it near an open flame. Answer. Verify the flow rate and secure it. Rationale. Verifying orders and securing the cannula ensures safe oxygen delivery. Option B is correct. Options A, C, and D risk overdose, dislodgement, or fire hazard. 70. What should a nurse include in a discharge plan for a surgical patient? A. Follow-up care and wound instructions. B. Diet preferences only. C. Visitor schedule. D. Hospital bill details. Answer. Follow-up care and wound instructions. Rationale. Discharge plans focus on recovery. Follow-up and wound care are essential. Option A is key. Options B, C, and D are irrelevant or administrative, not nursing priorities. 71. What should a nurse do first if a patient's wound dressing is soaked? A. Change it without assessment. B. Assess the wound and drainage. C. Call the doctor immediately. D. Leave it until the next shift. Answer. Assess the wound and drainage. Rationale. Assessing first determines the cause and extent of drainage, guiding care. Option B is priority. Option A skips evaluation. Option C delays action. Option D neglects patient needs. 72. Which step prevents infection when removing personal protective equipment? A. Remove gloves last. B. Take off the mask first. C. Follow a specific order. Gloves, gown, mask. D. Wash hands before removal. Answer. Follow a specific order. Gloves, gown, mask. Rationale. Removing PPE in order, gloves, gown, mask, minimizes contamination risk per protocol. Option C is correct. Options A and B disrupt sequence. Option D isn't standard before removal. 73. How should a nurse respond to a patient upset about a delayed test? A. Say it's not the nurse's fault. B. Listen and explain the delay calmly. C. Ignore their concerns. D. Tell them to complain later. Answer. Listen and explain the delay calmly. Rationale. Listening and explaining show empathy and clarity, improving trust. Option B is best. Option A deflects. Option C dismisses. Option D avoids addressing the issue. 74. What is the safest way to move a heavy object in a patient's room? A. Lift it with bent knees and back straight. B. Drag it across the floor. C. Push it with one hand. D. Ask the patient to help. Answer. Lift it with bent knees and back straight. Rationale. Proper body mechanics, bent knees, straight back, prevent nurse injury. Option A is safest. Options B and C strain improperly. Option D is inappropriate and unsafe. 75. Which vital sign change should a nurse report in a patient with fever? A. Temp rises from 100 degrees Fahrenheit to 102 degrees Fahrenheit. B. Pulse stays at 80 beats per minute. C. BP of 118/76 mmHg. D. Respirations at 18 per minute. Answer. Temp rises from 100 degrees Fahrenheit to 102 degrees Fahrenheit. Rationale. A rising fever, 102 degrees Fahrenheit, may signal worsening infection, needing prompt reporting. Option A is significant. Options B, C, and D are normal and stable, not urgent. 76. What should a nurse do to ensure patient privacy during a visitor stay? A. Close the curtain or door. B. Leave the room open for monitoring. C. Share updates with all visitors. D. Discuss care at the bedside loudly. Answer. Close the curtain or door. Rationale. Closing off the space protects privacy and confidentiality during visits. Option A is correct. Options B, C, and D expose info or reduce privacy unnecessarily. 77. How should a nurse assist a patient with bathing who has an foreline? A. Remove the fore temporarily. B. Cover the foresight and avoid wetting it. C. Bathe only the unaffected side. D. Skip the bath entirely. Answer. Cover the foresight and avoid wetting it. Rationale. Covering protects the foresight from infection while allowing hygiene. Option B is best. Option A risks complications. Option C is incomplete. Option D neglects care. 78. What should a nurse teach a patient to improve sleep quality? A. Drink coffee before bed. B. Establish a consistent bedtime routine. C. Watch TV until falling asleep. D. Nap frequently during the day. Answer. Establish a consistent bedtime routine. Rationale. A routine signals the body to rest, enhancing sleep. Option B is effective. Options A and C stimulate wakefulness. Option D disrupts nighttime sleep patterns. 79. Which action verifies a patient's identity before giving a blood transfusion? A. Ask the patient to state their name. B. Check the ID band and blood bag against orders. C. Use the bed number. D. Confirm with a visitor. Answer. Check the ID band and blood bag against orders. Rationale. Matching ID band and blood bag with orders ensures safety per protocol, 2 identifiers. Option B is correct. Options A, C, and D risk errors or lack verification. 80. What should a nurse document after assisting with a patient's ambulation? A. Distance walked and patient response. B. Nurse's feelings about the task. C. Time of next meal. D. Patient's favorite activity. Answer. Distance walked and patient response. Rationale. Objective data like distance and response, e.g., fatigue, track progress and condition. Option A is key. Options B, C, and D are irrelevant or subjective. 81. What is the best way to disinfect a thermometer after use? A. Wipe with alcohol and air dry. B. Rinse with water only. C. Leave it in the patient's room. D. Soak it in hot water. Answer. Wipe with alcohol and air dry. Rationale. Alcohol kills germs effectively and air drying prevents contamination. Option A follows infection control. Options B and D are inadequate. Option C risks spread. 82. Which patient right should a nurse respect when they refuse a procedure? A. Right to informed consent. B. Right to refuse treatment. C. Right to demand extra care. D. Right to skip hospital rules. Answer. Right to refuse treatment. Rationale. Patients can legally refuse any treatment, and nurses must honor this autonomy. Option B is correct. Options A, C, and D misalign with the scenario or rights. 83. How should a nurse position a patient recovering from abdominal surgery? A. Flat with legs bent. B. Semi-Fowlers with knees slightly flexed. C. Prone on their stomach. D. Fully upright at 90 degrees. Answer. Semi-Fowlers with knees slightly flexed. Rationale. Semi-Fowlers eases abdominal tension and aids breathing post-surgery. Option B is best. Option A strains. Option C is impossible. Option D may stress the incision. 84. What should a nurse do first if a patient's oxygen saturation drops? A. Increase oxygen flow rate. B. Check the pulse oximeter placement. C. Call respiratory therapy. D. Reposition the patient fully upright. Answer. Check the pulse oximeter placement. Rationale. Ensuring accurate placement rules out false readings before acting. Option B is first. Options A and C need verification. Option D may not address the cause. 85. Which precaution is required for a patient with shingles? A. Contact and airborne precautions. B. Droplet precautions only. C. Standard precautions only. D. Protective isolation. Answer. Contact and airborne precautions. Rationale. Shingles, varicella, spreads via contact and air, requiring both precautions until lesions crust. Option A is correct. Options B and C are insufficient. Option D protects the patient, not others. 86. What should a nurse assess in a patient with a new tracheostomy? A. Airway patency and secretions. B. Patient's diet preferences. C. Room humidity level only. D. Visitor schedule. Answer: airway patency and secretions. Rationale: airway and secretions ensure breathing and prevent blockages, critical for tracheostomy care. Option A is priority. Options B, C, and D are secondary or unrelated. 87. How should a nurse respond to a patient asking about advance directives? A. Say it's a doctor's responsibility. B. Explain they outline care wishes. C. Tell them it's not important. D. Avoid the topic entirely. Answer: explain they outline care wishes. Rationale: nurses educate about advance directives, which specify care preferences legally. Option B is correct. Options A, C, and D dodge responsibility or dismiss patient needs. 88. What should a nurse teach a patient to prevent urinary tract infections? A. Drink less water to reduce urination. B. Increase fluid intake and void often. C. Hold urine for long periods. D. Avoid hygiene after toileting. Answer: increase fluid intake and void often. Rationale: fluids and frequent voiding flush bacteria, preventing UTIs. Option B is best. Options A, C, and D increase infection risk by stagnation or poor hygiene. 89. Which action ensures safety when using restraints on a patient? A. Tie them tightly to the bed frame. B. Check circulation every 2 hours. C. Apply without a doctor's order. D. Leave them on indefinitely. Answer: check circulation every 2 hours. Rationale: regular checks, e.g., pulse, color, ensure safety and prevent harm, per policy. Option B is correct. Options A, C, and D violate safety and legal standards. 90. What should a nurse include in a patient's fall risk assessment? A. Age, mobility, and medication use. B. Favorite hobbies only. C. Room decor preferences. D. Time of last visitor. Answer: age, mobility, and medication use. Rationale: these factors, age, mobility, meds like sedatives, predict fall risk accurately. Option A is essential. Options B, C, and D are irrelevant to safety assessment. 91. What should a nurse do first when a patient's skin feels cold and clammy? A. Cover them with a blanket. B. Check their pulse and BP. C. Offer a warm drink. D. Raise the room temperature. Answer: check their pulse and BP. Rationale: cold, clammy skin may signal shock or poor circulation. Assessing vital signs first guides care. Option B is priority. Options A, C, and D address symptoms, but delay evaluation. 92. Which action best prevents infection during a urinary catheter insertion? A. Use clean gloves only. B. Maintain sterile technique throughout. C. Insert quickly without prep. D. Cleanse the site after insertion. Answer: maintain sterile technique throughout. Rationale: sterile technique prevents introducing bacteria into the urinary tract, reducing infection risk. Option B is correct. Options A, C, and D compromise sterility or timing. 93. How should a nurse communicate a patient's needs to the healthcare team? A. Write a brief note in the chart. B. Give a detailed verbal report during rounds. C. Text a coworker casually. D. Wait for the doctor to ask. Answer: give a detailed verbal report during rounds. Rationale: a detailed verbal report ensures clear, immediate communication for team coordination. Option B is best. Option A may lack urgency. Option C is unprofessional. Option D delays care. 94. What is the safest way to store medications in a patient's room? A. Leave them on the bedside table. B. Lock them in a secure drawer. C. Keep them in an open cabinet. D. Give them to family to hold. Answer: lock them in a secure drawer. Rationale: locking meds prevents misuse or theft, ensuring safety per policy. Option B is correct. Options A and C risk access. Option D lacks control and accountability. 95. Which change in a patient's condition should a nurse report immediately? A. Temp of 99.2 degrees Fahrenheit. B. Sudden confusion and slurred speech. C. BP of 124/82 mmHg. D. Pulse of 76 beats per minute. Answer: sudden confusion and slurred speech. Rationale: sudden neurological changes may indicate a stroke, requiring urgent reporting. Option B is critical. Options A, C, and D are normal or stable, not immediate concerns. 96. What should a nurse do to maintain confidentiality with electronic records? A. Log off after charting. B. Share login with a coworker. C. Leave the screen on when away. D. Discuss records in a public area. Answer: log off after charting. Rationale: logging off protects patient data per HIPAA, preventing unauthorized access. Option A is correct. Options B, C, and D breach security and confidentiality. 97. How should a nurse assist a patient with turning in bed post-surgery? A. Turn them quickly, without support. B. Use a draw sheet and log roll them. C. Ask them to turn alone. D. Lift them by the arms. Answer: use a draw sheet and log roll them. Rationale: log rolling with a draw sheet maintains spinal alignment and safety post-surgery. Option B is best. Options A and D risk injury. Option C may be impossible. 98. What should a nurse teach a patient about preventing medication errors? A. Take meds at random times. B. Follow the prescribed schedule and dose. C. Share meds with family. D. Stop meds if feeling better. Answer: follow the prescribed schedule and dose. Rationale: adhering to prescriptions ensures safety and efficacy, reducing errors. Option B is correct. Options A, C, and D lead to misuse or harm. 99. Which action confirms the right drug is given during med administration? A. Check the label against the MAR 3 times. B. Give it based on color alone. C. Assume it's correct from pharmacy. D. Skip checks if familiar with it. Answer: check the label against the MAR 3 times. Rationale: triple checking the label with the MAR follows the rights, ensuring accuracy. Option A is standard. Options B, C, and D risk errors and violate safety protocols. 100. What should a nurse assess in a patient with a pressure ulcer? A. Size, depth, and exudate. B. Patient's favorite food. C. Time of last bath. D. Room lighting conditions. Answer: size, depth, and exudate. Rationale: assessing ulcer characteristics tracks healing and guides treatment. Option A is essential. Options B, C, and D are unrelated to the ulcer's status.